As we look to build better systems for breast cancer care, one of the important references is to ensure that every woman has the best possible breast cancer care, the highest quality, that adheres to the scientific foundations of what we've learned over the past decades, because that is fundamentally one of the biggest drivers of improvement in breast cancer care. So to better understand how are these standards developed, what influences them, what are the references that are used, how up-to-date are they in line with other national reference documents such as the National Essential Medicines List? We did a systematic evaluation of guidelines from about 50 countries. Just to acknowledge that this was done as part of a broader research group led by Dr. Dario Trapani. What we found is that there are many variations in how breast cancer guidelines are developed, and similarly, there is the need to strengthen breast cancer guidelines that are appropriate to the context for countries that are of a low or lower middle income foundation. And the reason is because often these countries are using reference documents from high income countries and applying similar principles. Trastuzumab, for example, the use of trastuzumab in tumors that are less than 1 centimeter. This is something that some low-income countries were including in guidelines, which reflects a different reality than what we know is happening on the ground. Because in fact, it may not be available for those communities, and if so, then it shouldn't be reflected in the guidelines. What was the evidence to support when that was included? What was the process? Was it costed? Did someone check with the government and ensure that the budget would be available, that a reliable supply for a year would be there? These are the types of questions that we started to answer through this research paper. The take-home messages here are that when we develop guidelines, there is a need to understand the science. There's a need to apply to the context. There's a need to bring in the patient voice and to ensure that the people who are developing the guideline reflect different sectors, different backgrounds, and different expertise, and to ensure that in that process, the specific needs of that country are met, that the government signs off on the document, and that the decisions made are reflected in other governmental documents, including, for example, what medicines are procured and how much.